Welcome to our third Thursday. My name is Patty Siebold, and I'm the board president of the Boothbay Health and Wellness Foundation. And we're just wanted to give you a couple of reminders about upcoming events. First of all, as you know, our mission is to promote health and wellness here on the Boothbay Peninsula. And in particular, we are trying to make sure that everybody has access to affordable, accessible care, health care, as well as programs to promote health and wellness. And so we have a number of programs some of you are participating in already, and for those of you who aren't, I want to just mention a couple. One is the Seniors Walk Free at the Y program, which is every Tuesday and Thursday from 10 till noon. Whether or not you're a member of the YMCA, you're welcome to come and walk around the track. And we have about 75 seniors who are doing that now, people 65 and over. And we're keeping track of how many laps we're doing, and in 6 weeks we've all increased about a third of the number of laps we're doing. So we're keeping, trying to egg each other on. And that group, the group that came up with that program, meets once a month, and we're meeting again on Monday afternoon at 4 p.m. at the Boothbay town office. And basically what we're trying to do is come up with what are the next programs that we'd like to roll out for seniors. Some people have said, well, let's have dancing.
The applications.
Yeah, thank you. So could be dancing, it could be a senior center, it could be exercise programs, whatever. We need to kind of decide what those are. And as June points out, we're also facilitating the half-price transportation coupon program that MDC is running. And for anybody who is a senior or has any disability, who doesn't drive, can't drive at night, doesn't have access to a car, we have applications, we'll help you fill them in, and you get 50% off a taxi, any of the local taxis. So let me know if you're interested in that program. I'll make sure you get more information about that. And then on Tuesday, this coming Tuesday, is our monthly board meeting, and the first 2/3 of that meeting is always open to the public. And again, it's at the Boothbay Town Office, starts at 6:30 on Tuesday night, the 20th. And with that, I'm going to turn it over to Valerie.
Thank you, Abby. My name is Valerie. I'm a board member of the Health and Wellness Foundation and help to organize some of these third Thursday events. So every third Thursday of the month, we bring a new speaker to talk on a health or wellness topic. And one of our board members, Ted, mentioned his friend Catherine, who runs the Lincoln County Dental Clinic, or who is one of the board members and founders of the Lincoln County Dental Clinic. And so I called her up, and she was very enthusiastic, which was very nice, and agreed to come and talk to us about dental services that she provides and that her team provides, and about how those services could get extended to the Boothbay region. So I just wanted to give a little bit of a bio on Catherine, without embarrassing too much, hopefully. Catherine Young, she's a volunteer denturist and a board member at Lincoln County Dental. She, along with 7 other members of the board, founded the clinic. It is currently located in Catherine's private practice office in Damerscott area. It's called Denture Designs. She's been working for 23 years in the dental profession. She started as a lab technician and then worked her way up to dental assistant, various phases of dentistry, and now she owns her own dental laboratory and has founded this great organization. And she moved from Bangor to the Mid-Coast area about 10 years ago, and in June of 2006, she graduated with honors from the IDEC program, which hopefully she'll explain what those letters are, of George Brown College in Canada. So she's been going to school, starting this clinic, starting her own private practice. So she lives in South Bristol, and she owns her office in Damerscott, and she's actually a South Bristol native. So she's from Lincoln County here, and now she's returned back to us and serves all of her community members. She's also here with Dr. Jim Olson, who is another board member. He's president of the board of directors and a volunteer dentist. He's retired from his private practice. So without further ado, I will introduce Catherine. Thank you so much for being here.
That's quite an introduction. So, give me a vote. Does anybody want me to put on the microphone that squeals?
What's the squeal?
Does it squeal? Oh, it's a squeal. Okay.
Sounds good to me.
Does it seem like I'm loud enough?
Yeah.
If you change your mind, let me know. I'm happy to put this on. But as most of my staff will attest, I'm fairly loud. So it's a wonderful introduction. Where'd she go? She ran away. She introduced me and escaped out of the back side of the room. Did you see that? It's wonderful to come out into the community and start introducing what this program is. One of the things that not everybody is aware of is what is Lincoln County Dental. Sometimes it gets a little bit confusing because Lincoln County Dental is a program that lives in my office. So it confuses the two, and people go, what's the difference? And my patients will even come in and say, who am I a patient of? Depends on the day of the week. So we'll talk a little bit about that, because what we want to do is let people know what those resources are and what it is we're doing out there. Okay? So my name is Catherine. The letters after my name are licensed denturist. My degree is Canadian. It's a little bit different. There are only 26 of us in the state. And the IDEC is the International Denturist Education College. Denturism is a slowly evolving profession in the United States. I can practice in all of Canada, Europe, South Africa, but not New Hampshire. Okay. We do what we can, where we can, to the best of our ability with whatever we've got to work with. So it is an interesting world.
Yeah.
Dentistry is my chosen career. Public speaking is not. So when I lose my place, when I fumble, when I forget what I'm saying, I'll make something up quickly and move on, I promise. But as Valerie said, this is actually going on my 25th year now. I need to update the website. 25th year in dentistry. Public speaking has never been my strong suit, but it is a wonderful program. It has great value, and so bringing it out to the community to let everybody know what resources are available and how to navigate them, because dentistry in and of itself is a difficult, expensive endeavor, and it's hard to navigate. There's no one that can chop up a profession more than dentistry. I think there's 17 different dental providers, and you go to all sorts of different providers for different things in different places. Dr. Olson, who came with me today, is one of the era of dentists who were taught many things in dental school. Now we seem to graduate a whole assortment of specialists that each do little things. So it's changing, so it becomes more confusing to navigate. So Lincoln County Dental's mission is to open the doors to dental care, because we know there are a huge number of people in the Lincoln County area who don't have the means to access dental care, or it's confusing on how to get into offices, where to get them. They call up, they say, hi, I need a dentist. They get asked 75 questions and they hang up going, whoa, that was a lot of work. And they run away for a couple of years. So dentistry can be a cumbersome thing to get involved with when you're a patient. So we try to make that easier. That's one of our goals. That said, it's an application process, and Lincoln County Dental sees patients who are at or below 200% of the poverty level and have no other resources. So we are the place when somebody doesn't have insurance, they don't have the means to pay for care, they're below 200% of the poverty level and they need some support. That's when they fill out the application process, so we complicate it too, to become a patient of Lincoln County Dental. Okay. Go ahead.
So for those of us who aren't aware, what does being 200% below the poverty level mean in annual income for
A
typical person or a family or whatever, however you would?
Is that on the newsletter? This is what I have. A family of four, I think, is $16,000. Might be lower than that. They've just changed it. They've just changed the numbers. A family of one, I think, is $13,600. That's the lowest benchmark.
They've just changed the federal poverty level to raise those restrictions. We work for anybody who is at 200% of the poverty level or below, which are the majority of your senior citizens with no secondary retirement plan who do not have any other means of income. Is it on there?
Yeah.
Is it?
Do you have glasses? No more of mine.
A family of one is 19,500. A family of four is 40,000. So it does change depending on if they have children. Okay.
Yeah.
So little kids are expensive. We know that. Okay. So, and it is on these. I brought down some of the newsletters. It's one of the older newsletters from this year, but there are some of them out on the table. So it has that chart on the back. It's a good question. No, I don't have it memorized. So the reason that Lincoln County Dental started was we recognized that there were a huge number of patients in Lincoln County, both on the Boothbay Peninsula and in Damariscotta, who were accessing the emergency room for dental pain. A lot of them were third, fourth, and fifth time visitors to the emergency room because they come in and say, I have a toothache, I don't have a dentist, I can't get in. They would come to the emergency room to receive antibiotics, painkillers, a thing that says, please go see a dentist, and then they would go away, take their antibiotics, show back up 6 weeks later going, I have a toothache, and it's still the same toothache. So it was really easy to have a conversation with the, then it was the St. Andrews campus, just to give them a good plug, that said, yes, we will be your fiscal agent for your bigger grant that bought most of the equipment. Because again, the doctors volunteer their time, but dentistry is expensive. So when we went to them and we said, look how much money you're spending on non-definitive care to do nothing for people other than to hand them a $10 prescription for amoxicillin, they said, yes, we will help you. So we created the emergency referral system, and that was where we started, was getting people out of pain, getting them on antibiotics, and then creating a referral option where they could see a dentist and get the tooth out, get rid of the infection so that they weren't repeat visitors to the emergency room, raising everybody's taxes and suffering on antibiotics. Okay? We probably still get Dr. Lee, who is, I believe, down here. He is fantastic. If anybody who doesn't know Dr. Lee or who does know him, he is a fantastic physician. He is great at follow-ups. We will come into the office in the morning and we'll have a message on our voicemail that says, hi, this is Dr. Lee from St. Andrews, and I have such and such, and he has this problem. I have done this. Please let me know how that works out. And he and my office staff will email one another to follow and track a patient's care. Did they come in for care? Did they call us? Do we have his contact information accurate? And he'll keep track and follow up with them to make sure that we have the opportunity to get them out of pain. And it's great fun because he's figured out he can call at 2 a.m., leave us a message with all the information and not have to chase it the next day, which is, it works, it's convenient, and he leaves us all of the patient's information. And we probably get at least 2, if not 3 patients from him from down here a month. So.
He's not just brilliant, he also teaches at Harvard.
Does he?
Yeah.
Yes. So he's a good guy. So prior to 2009, when we started this adventure, Lincoln County was one of only 3 counties that didn't have a dental safety net site, a place where low-income, uninsured people could go and say, I'm in pain, I have infection, will you help me? Without them saying no. Okay. The only other 2 counties were in northern Maine. We were the only one on the coast. And when I went to Augusta, I said, how come we don't have a dental safety net in Maine, in Lincoln County? They said, oh, you don't need one, there's tons of money down there.
Oh, wow.
Really? I grew up there. I don't see it. Yes, there is a whole portion of the population who does have tons of money. But it's not everybody, and it's not the entire population base. And one of the interesting things in a statistic that's in here, so I'm going to throw it in this point, 47% of children under the age of 18 living in Lincoln County qualify for Maine Care, which means they are below 138% of the poverty level. So their family incomes are below where we are. So we have a huge number of kids in need in Lincoln County, and that is 2 or 3 points higher than the state average. So we actually have an above state average number of children living in poverty in Lincoln County. It's kind of an interesting little statistic that most people don't think of when they look at the $1 million homes on the coast. I live in South Bristol, very much like you guys in Boothbay, We have some pretty houses on the coastline. They're nice, they're great, they're lovely. But what it does is a lot of that tax base makes it so the rest of the state of Augusta says, you have tons of money, you don't need us. And the 47% of children have no access to care. That's a problem. So it's one that, and neither do our seniors. Kids and seniors tend to mirror the same ways. So in 2009, we formed a group of dental providers. I went to Dr. Olson. We were spending a lot of time in Augusta together at the time, working on some political statewide issues, different scope of practice things. So we spent a lot of time driving to Augusta and back again. And so we went to the other dentists in the area and said, hey, we need to do this. It's important. So Lincoln County Dental went from just an emergency referral coordination of care network to Dr. Olson said, I'm really only working a day or two a week anyway. I'll retire and come do this. So he was still in private practice in 2009, still working part-time in a private practice, and he said, I'm ready to retire anyway. I'll just come do this. So hats off to him. I have some other ones that are great, but he's there every Tuesday. If he's out doing something on a Friday afternoon, I can find him, I can call him, and he's there for me if we have questions. So it's great. It's a great resource for my ladies to have. It really is. So what we did was we went to the rest of the dental community, Dr. Olson, Dr. Griffin, who also teaches at Harvard, Jennifer McDonald used to run the Care Partners program, which is it was the charity care program it's chopped up by county for people who don't have any health insurance. That program's kind of going away with the Affordable Care Act and with some of the changes that Maine Health is making. So Jen said, I have 3 teenagers, I'm going to go do private nursing, and Jen is in our office on Thursdays. So she's there with us to help coordinate who's doing what where, because in dentistry we like to look at our own little islands of things to do. Janet Spiller is a retired hygienist from Massachusetts who retired to Chamberlain, Maine, and so she is in the office on Thursdays seeing hygiene patients and doing preventive care. The young woman in front of me is Elise. She is my right arm in the lab. She's not a board member. She does work with Dr. Olson as an assistant on Tuesdays. She's a lovely woman. There was some thought that said, well, she's not a board member. Should we take her out of the picture? I went, no. She's part of my support system. She is her ability to keep things calm is my ability to function. Dr. Jeff Grosser is a retired dentist from Wisconsin. He primarily does oral surgery. Dr. Grosser gets the majority of our patients who are in pain, infected teeth, doing surgery, taking them out because they can't afford root canals, they can't afford to save them. Because in dentistry, if you need to root canal a lower molar, the average is about $1,500. We just paid for one for my stepdaughter yesterday. So even those of us in dentistry, we see how expensive it is. It's a lot. And sometimes that's not feasible. It's easy to spend $2,500 on a single tooth in a dental chair because it can be a root canal, a filling, and a crown. That goes quick, but it's expensive. Dr. Steve Sedansky is an endodontist who is working part-time in Massachusetts, and they moved back there. He does root canals. He did 2 today in the office. He does them at a reduced fee, but even people who want to save their teeth look at something and they say, well, it's all well and good that you can save me 62% on a root canal and I only have to pay $400, but that's still a lot of money and it's 2 paychecks. Please take it out. And the subsequent crown that they need is beyond their means because we don't do crowns. Crowns are, the big ticket items are expensive. They're expensive for everybody to pay for, but they're expensive to provide. So we're basics. Okay? We try not to get too fancy because then we get expensive. So we're trying to keep costs down and keep things simple. The way we started was with a $95,000 grant from the Dory Taylor Foundation. Mm-hmm. Dory Taylor bought us tons of equipment, dental equipment, that X-ray units, digital sensors, the computer program. Dental computer programs are astronomically expensive. And all of the handpieces and little tiny burrs they do fillings with and all of that stuff. That's where the majority of that went. And to the auxiliary staff that answers the phone and processes applications and makes appointments and cleans the office and does all of those important things that keep people safe. The program received an award. We didn't have a picture of everybody. They received an award in Augusta because it's one of the first places that the dental community has come together and said, our community has needs, let's create a program. Everywhere else in the state, apparently most places in New England, the majority of programs are created either by bureaucrats or somebody else wanting to start a nonprofit or as an add-on to something else, or by a bunch of investors who want to make money on dentistry, and if they figure out how to balance the leverage resources, they can have a safety net that can be state and federally funded and still make a profit. Happens. We don't like it, but it happens. So the program received an award in Augusta for being unique in that fashion, and I actually took a similar presentation. The New England dental directors said, what are you doing? Come tell us. And so I took it down to Massachusetts and talked about it down there. And so it's received some recognition nationally, which is fun. Which is fun. It's nice to be different. We like to be different on the coast of Maine. These are a couple more of my doctors. Dr. Greg Albert, we usually send him for kids. He's left-handed. My operatories are right-handed. We haven't figured out. It takes about $25,000 to create an operatory that is left and right-handed. We just send him to do screenings on kids. We don't bring him over to the office because it's a lot. I mean, that's a lot. That's a lot of resources to leverage. Dr. Davis is in the office every third Tuesday of the month and is a very active board member. Again, Dr. Grosser. And this is what we look like on Tuesdays. Yep. This is what we look like on Saturdays. Okay? I send people out into parades. The giant tooth is often and usually me. There's a good picture on our website of me climbing a kid's wall. This is a Halloween party, and we take the tooth fairy and the giant tooth and run around with a little Halloween hat. I don't know if you can see it in there, but it has a toothbrush dangling in the middle of it to give away toothbrushes. So we ship the tooth fairy out on the street, put her in a dress. It gets people talking about it. The tooth was in the giant breast cancer walk because people start going, oh, a giant tooth. And then we walk around with baskets and give people floss. We look at us like we're crazy, but it's really kind of fun. So what we do is we start with kind of what we call a 3-tier approach. The first one is to reduce suffering. Kind of a good place to start when you're going to do a community program, which is alleviate acute infection, get rid of people shouldn't have to suffer. In the United States, in this economy, with the resources we have, people should not be spending weeks or months on end suffering from dental pain. So that's where we start.
Here, here.
Once we get people so that they're not living with chronic infection and pain, then we kind of pull them forward a little bit and go, okay, how can we prevent that from happening? So it's to stop the progression of the disease, okay? Which dental decay is a bacteria, okay? So it's how do we stop that? And how do we make them aware of what that chronic infection is doing to their body? So how do we, let's get you out of trouble, let's keep you out of trouble, and then let's teach you not to get into trouble in dentistry, okay? So we talk a lot about oral health literacy. And what that really means is to try to give somebody the tools for the knowledge we have to prevent dental decay and ending up in infection. But people are scared of us. Okay? I love this slide because a lot of you were baby boomers or just after the baby boomer generation. So if you were born just before the baby boomers, you are modern dentistry's guinea pigs. They picked on you so much. Really, we were just figuring it out back then. We're much nicer now. You don't have to believe us because I know you're all scared, okay? But it's part of what we did. But early dentistry was a little mean. I mean, one of the things that they thought 70 years ago was little kids' teeth don't have nerves in them. Don't bother to give them Novocaine. We don't think that way anymore. We know little kids' teeth have nerves in them. We give them all Novocaine. We promise. We share that very liberally. Okay? So the objectives behind that first level is working with volunteer dental providers, auxiliary staff, to create a consistent resource that when we talk about debt forgiveness, doesn't cost somebody anything to figure out what's going on with their teeth. When we bring somebody in, yes, there are expenses associated with the program, but that first exam, if it's an emergency exam and an x-ray to go, what's going on, or if it's a comprehensive exam that is pictures of all of your teeth and an exam with a dentist, it doesn't cost anything to figure out, and that's a huge resource for somebody who has no money. I don't know what's going on with my mouth, I just know it hurts. I haven't been to a dentist in 15 years. It's a common complaint. And what we're trying to do in that level is reduce the emergency room for dental pain, reduce narcotics, reduce antibiotics, get people out of crisis, increase their health, and get them to stop taking time off because their face hurts, and it's swollen, and it's infected, and they're sick. So that's kind of what that first level is. But those people don't usually like to come back to the dentist because they're in pain. So when we sit down to do an exam, we drive them right through the ceiling and touch the tooth, and they go, oh, okay, that hurts. These are not people who are interested in sitting in the dental chair, so the problem gets worse because they avoid us more. So when we move on to the second level, which is that second tier, that middle tier, it's definitive care. It's doing fillings. It's how to make them not sensitive. It's how to make things not hurt so that they're not miserable, so that they're willing to sit in dental care, so that we can, instead of managing an urgent care issue in an emergency room, we're preventing an urgent care issue because they have an office to be in, they have a location they can come to. It increases their overall health, their self-confidence, their employability. They can chew. That's kind of handy. We like to eat. I do. Okay? And we actually get them in the chair doing something with them. Okay? They're willing to sit in the chair at this point. That's kind of nice. And then when we get the biggest crises out of control and the basic maintenance, and then we go into that third tier, which is changing the culture. Some of the patients at Lincoln County Dental have had consistent dentists for years. Some go to the dentist about once every decade. So it's a mix. There are some people who don't recognize I should have a consistent resource to be at the dentist every 6 months. And then there are some people that go, what, I need to do that yearly? So it's trying to create that change that makes it not frightening to go to a dental office, something that's affordable, something that then works to give them some of the tools that reduce the time frames that delay treatment. That way they're coming in every 6 months, consistent exams, consistent x-rays, because the x-rays still, the follow-up ones we do 6, 12 months later, we don't charge for them. It's one of the things that we really feel is important, that it shouldn't cost somebody. They may choose not to support, do anything about it, but they should be able to figure out what it is they need to do. And if we can reduce the time frame so that that little cavity that they have on one tooth doesn't go 6 years before it's fixed, then you reduce the urgent care needs. So it's kind of those are the 3 steps. So, any questions? Can you hear me okay? Am I loud enough?
Yep, I can hear fine.
Told you I'd be loud. So what are our goals? 2014 goals, looking ahead. I have a lot of support up in the Damascotta area. Les Fossil in the back is one of my big advocates. He's on the monthly Dental Coalition meetings. He was a huge advocate in Augusta on the Health and Human Services Committee for taking care of our children, which is hard in Augusta when you're on the Health and Human Services Committee to really look at, because there's so many needs. There's so many things you have to do. And he was fantastic. He's on the, I'll get this wrong, Physicians Improvement Committee? Performance Improvement Committee. And so one of the things that Les is working with me, with the Dental Coalition, with the projects that we have in 2014 is to get oral health on the physicians' work plans so that it's a performance thing. Okay, so I'm kind of going, hey, pay attention to oral health, and he's helping me with that. So he's what we call an oral health advocate. They have a name. Spy. He's my plant. Pay attention to. So one of the things that we're working on doing now is adding a public health supervision who can travel to different areas. One of the projects that we're working on is the equipment, the funding, the grant to support the administrative needs, because there's no money in it. That's why nobody does it. Okay? There's no money in it. So we have to find grant funding to pay for the equipment. To be able to send her out on the road. We were talking with putting a public health hygienist in the high school down here. There's no dental hygienist that's screening kids or doing anything at the high school. It's one of the, Wiscasset and Boothbay are the only two left that don't have one. So that's on my work list. We don't have a public health supervision traveling to any of the nursing homes. There's no money to travel to nursing homes. There is money to pay for equipment to travel for kids. And since a lot of you are over 12, I'm going to share this with you. I noticed it wasn't the gray hair. I just noticed. I can't find a grant that says, let's buy mobile dental equipment to go into nursing homes and retirement communities and bring resources to seniors. But I can find grants to say, let's buy mobile equipment to pay a hygienist to go into the schools to take care of kids. Well, why on Monday through Thursday, it's the same equipment. On Monday through Thursday, she can go to running around to all of the schools, doing all of the kids and all of the things that support the grant. Then she's already got the equipment. What are we going to do with it on Friday? Let's send her into the retirement communities. So if we marry the two together, then we might be able to afford to do it, okay? But it's on my list. So anybody who wants to help with the list, I think my phone number's on the screen, right? And then the video recording. So one of the other resources is to start seeing main care patients through Lincoln County Dental. And we haven't figured out exactly how to navigate that because the Lincoln County Dental fee schedule for patients is the main care fee schedule. And we have proven repeatedly that you cannot support a dental practice on main care fees that the state sets, even when the dentists work for free. Okay? You can't do it. And one of the reasons everybody will say, oh, dentists won't accept main care. But one of the financial things behind why dentists don't accept main care, you have two dentists in Boothbay, neither one accepts main care. This is why. Stop thinking poorly of it. In order for the dentist to support the lower cost of doing the charity care for main care, they have to raise their fees an average of about 62% to all of their other patients. So is that fair? It's 62%. There's actually a movement in Augusta, and we love this in dentistry. They want to raise the main care fees up to 10% of cost. We love this. We're like, okay. We appreciate the 6% of cost you like to reimburse us. You know, and we have, it's cheaper for me as a denturist, because I have 4 different programs that we work with. I make dentures for main care patients. I make dentures for Lincoln County Dental at the main care fees, and I volunteer my time, okay? Both dentures are $393. It is cheaper for me to make a denture completely for free for Lincoln County Dental than it is through my private practice to do one under main care and get reimbursed because of the paperwork.
Yeah.
I would skip the one for main care if it wasn't politically incorrect to do so, I would just do 2 for Lincoln County Dental. Because it is less paperwork. And it's less expensive because I've got 10 or 12 hours invested in any main care claim of office support. Lincoln County Dental, there's a lot there. We're good. So there is a difference, and that's something, if we're going to fix access to care for main care patients with dentistry, that's what we have to fix. We have to find a way to balance that, which is why only safety net clinics are really still seeing main care patients and why private practice dentists are not. Because for the patient who is at 201% of the poverty level, who is skimping on groceries to pay to get their teeth cleaned, to raise the fees 62% doesn't seem fair. So that's why most dentists don't see main care. Okay. One of the other goals is to write in some funding for coordination of community resources. Drives me crazy, everybody's trying to reinvent the wheel and everybody's overlapping in different places, and I would really love to just have one person that went to every nonprofit and every program and every outreach corner of the world, and that's kind of why I'm doing these presentations around, going, who's doing what, where, and where do we match up? So that we're not wasting resources. I mean, I know some places there's lovely ideas and projects and things like that, but I need to try to insert oral health into every place we can because we don't have any funding for it. We also have some outreach measures for kids of all ages. We have a focused education program that we're starting to do in 2014 that is just focused on pregnant women, small children, and from birth to age 9. Because we can't always just reach people when they're in crisis. We want to try to change some of those things. And that's a big project. Les spends every 3rd Thursday Is that it? Every third Thursday afternoon with me, working on how we integrate that into the community. Did I mention I have a 15-page paper for you to read? You know, he'll do it too. Because a lot of people will come help me and they're like, yeah, sure, thanks. They read the first page and a half and they go, oh, wow, that's a lot of work. So we're talking with the Miles campus about intervention strategies for pregnant women and getting the OBGYN nurse from the OBGYN offices to come sit at those meetings every third Thursday and spend time with us for how do we reach pregnant women. Because we know that the bacteria that destroys teeth most often in small children is passed from the mother or primary caregiver to the child. So that's why we're focusing on small children too. Because to really reduce, the best thing we can do to reduce the access to care issue is to reduce the need for care.
Are you meaning in the birth canal they're infected?
No,
or-
afterwards.
After?
Have you ever seen a baby drop a pacifier on the floor and mom go, oh, she really needs that? Pick it up, lick it off, and stick it in the baby's mouth?
No. Yes.
No. So it happens. It makes us in dentistry cringe, going, oh my God, I hope she doesn't have cavities. But that's where a lot of that comes from. Parents share silverware with their small children. So, I don't know if you can read this. It says, does it hurt to chew? Only when my mom makes me eat broccoli, liver, or tofu. So we're starting to look at kids. We wanted, when we first started, to get rid of suffering. And it's not that children weren't suffering, but children did have resources. Okay? The school-based staff, we've got a special needs teacher from South Bristol, who is part of the coalition meetings when she can be. I don't have anybody from down in the school systems, but I do have Kathy Cole, who helps supervise the wellness center at the school at Boothbay. I don't really know what all of it is, but she's interested, which has helped. So you do have a resource up there who is paying attention to what I do on Thursday afternoons. When children's oral health suffers, so does their ability to learn. So that's really why we want to create some of this change. One of the things we know is going on a lot in dentistry is this new liquid sugar that is in everything now. For years and years and years, there was my generation of the 40 to 50s, somewhere in there I fall, there was a decline in decay. You probably saw your children had less cavities than what you did because they had fluoride. You saw that change in the culture and the generations. There was preventive care, there was fluoride, there were all of those things. And so there were less cavities. Well, we're starting to see that rise again. And it's not because the access to care issue and the shortage of dentistry is as big of a deal as what everybody makes it. It's because there's more restorative needs for small children than there were. And that's the liquid sugar and preservative-based foods that everybody is eating. You know, it's the chips with the fructose corn syrup and all of the other things. So we're starting to see those decay rates in kids climb. So that's nutrition, that's oral health, that's taking care of your teeth, that's all of those things. So that fact I threw in there earlier, 47% of Lincoln County children qualify for main care benefits. Lincoln County does not have a pediatric dentist. There's no one taking care of kids, except for the kids that go into some of the general dentists. But if they need specialty care, if they need to be referred out for sedation, they're leaving Lincoln County. Only two dental practices in Lincoln County are accepting main care, and only one's accepting new patients. So, but there aren't a lot of dentists, okay? When we look at the average number of dentists that can take care of the population base, the American Dental Association says each individual dentist can handle about 2,500 patients. Well, with the way the population base is and the number of dentists, there's about 3,600 per dentist. So it's about 1,000 more patients than they technically can handle. I don't know who did this statistic, I didn't make it up, but it's interesting. You've only got the 10 practicing dentists. Some are retired, and some are working outside of Lincoln County. So there's not a lot. This is kind of an interesting, from Southport, if you have a kid living in Southport that needs to go to a dentist who accepts main care, they're traveling 24 miles, 47 minutes. That's each way. That's a long way. And if that child needs special sedation or has special needs, they're going all the way to Fountain. Nothing I'm doing is going to solve the access to care issue for small children with pediatric needs at any point in the next 5 years. Unless somebody would like to go find a pediatric dentist, marry them, bring them food. There's not, send them up soon. Okay? It's just, it's a statewide issue. There aren't enough of them around. But it's a long distance from anywhere in Lincoln County. So I picked Southport, Ocean Point, South Bristol, because they're all peninsula bases. Okay? She's cute, isn't she? No, that's good. I don't know if half of Maine kids don't have access to routine dental care. This was an ad that they were using for, does anybody follow the politics of dentistry? They're trying to create new levels of dental providers to do more different things. You remember me saying we have more different levels of dental providers than anybody else? We don't need more. We need better organization and coordination of the resources we already have to help the kids we've got. So if we can organize care, we won't have to spend quite too much money on it. So we have 2 grants. How am I doing on time? Anybody sleeping yet? The lights are starting to get dim. Anybody sleeping other than Dr. Olson because he's heard this 75 times?
You're doing fine.
The purpose of the 2 grants that we're working on now, and this is a lot of what Les is helping me do, is there's a grant for the Maine Oral Health Funders wants to make lasting improvements to children's oral health. So they've given us a grant to say, how do we go out into the community and access people? And access resources, where do they need to go, where do they need to be? Build a plan and then come back to us with your plan and apply for a multi-year grant. So I'm looking for people that have an opinion, okay? Because we're in the planning grant stages at this time, okay? So somebody who says, I have a great idea on how we can impact kids and oral health in pregnant women. We're working on it. The other one that we have is the Maine Health Access Foundation that wants to support focused, coordinated efforts in Maine communities working to increase the number of residents who receive Maine care. Well, when it comes to the Health and Wellness Foundation, this is a lot of what we're looking at, is where do the dental benefits need to go for people who need care. So if I can get the equipment to put a hygienist in Boothbay that is linked to referrals that sees Maine care, then does that help bring some resources back down on the peninsula? If she has what we call public health status, can my existing patients that travel from Boothbay all the way up to Damerscott also see her down here and go up to Damerscott for their restorative work? Because I have a limited number of dentists. And we put in a grant for the portable dental equipment that will then let the hygienist go into the nursing homes, the retirement communities, the smaller schools that don't have a health center like the grade schools, and go see nurses, Head Starts and daycares and all of those other things. Again, I make dentures. I work with big kids. So I need some help with the small kids. And one of the things we talk about at the meetings is most of my patients are at least over 18. I would love to have more people who are interested in kid-based community projects. My daughter's 24. Well, what grade are they in second grade? How old are they? I don't remember. So anybody who's interested in those things, I'm looking for people in the community who want to work on those projects. Because I'm not the best one to lead a kid-based coordinated effort for children. I can coordinate the grants, I can attach it to the programs, I can help with the funding and the budgets and things like that. But the kids-based programs, when we go into the retirement communities, I'm there. No problem. So I just did that. I forgot I put that grant in there that said explain the other slide. Okay. Yeah, specific focus of the Maine Health Access Foundation grant. That's something that Boothbay really needs. We see a lot of people who are in the emergency room down here. And again, I probably get at least 2, if not 3 a month from Dr. Lee down here in Boothbay, who are just suffering in pain. So the emergency care, we did, I think $32,000 worth of care last year for Damerscott alone, just in 2013. And Boothbay it's one of our 4th or 5th biggest towns, and I could actually get you the numbers on that, but we have a lot of people who travel up from Boothbay. People in Damerscott and Edgecombe will have the tendency to go to Brunswick. People from Boothbay are already tired of driving by the time they get off the peninsula, so they come to Damerscott. So there is a difference, and I think that's the logic, I'm not sure.
The river road is shorter.
The river road is shorter. Yes, and it's spring, so it's not full of a million crossings. So we're in the planning process to look at identification of opportunities and existing gaps. I know Boothbay is an existing gap. I also know St. Andrews has got a bunch of space that they're not using. So you are the identification of an opportunity, and you are an existing community asset and a resource gap. So you are, the Health and Wellness Foundation is line one. We're looking for parents, caregivers, and the public to, how do you want to approach this? Okay, that's the advantage of a community-based program is the community says, this is what we need, and the dental community coming together saying, this is what we have the opportunity to do that is quality care, that is effective, that can be paid for, that is worth your time. That's the relationship in the marriage that we're trying to create. And we're looking for the most likely strategies to reduce decay in adults and children. This slide says children, but I still focus on adults. Okay? So what do we need in the future, in the growing future? All right? We need fundraising volunteers because, again, dentistry is expensive. Board grant writers, nurses who like to review health histories, all of those things. Send me a body, I can usually put them to work. I told him, I need to get the word out as to what we're doing. He brought me you. Community oral health advocates. You don't have to be a former politician to be a community oral health advocate.
Recovering
politician. I have a really hard time trying to get oral health into nursing homes. Okay, again, you're all over 18, so I'm going to give you a couple of different facts. If you can introduce what we call an oral health aid into a nursing home, we know there is generally an 18% reduction in pneumonia. People live longer, they live more comfortably. They don't end up getting pneumonia and dying of pneumonia. 18% is a lot. That's a lot. But when we talk to the nursing homes, they kind of go, oh yeah, that's a great idea. And they run the other way, screaming, okay? So if anybody wants to work on that project, let me know. Because I have a hygienist who would love to get a grant and travel into the nursing homes. She wants to work with seniors. I love my older patients, I really do. That's why I went into the line of dentistry that I'm in, is I wanted to work with older patients. Well, I found a hygienist that wants to do that too. Administrative support, you'd be amazed how much paperwork there is. So I'm looking for a board secretary. We're looking at where we expand the board. Where does it go? Where are those resources? What are we up to? Who is interested in this project? Okay. And I'm always looking for more dental volunteers. Okay. I really am. If you have a retired dental person that is interested in volunteering, or Dr. Davis takes the morning off to come work with us. Dr. Davis in Damerscott is a sweet man because he's not waiting until he's retired to do it. It would be cheaper for that man to mail me a check and drive by my office. But he shows up every second Tuesday of the month, gives me a morning, pays attention to the community project. What else do you need from me? What can I do? And he sees some patients while he's there. That's huge because, again, it would be cheaper for him to mail us a check. That was another one.
We can't tell.
It says, if my dentist makes money on bad teeth, why rely on a toothbrush 4 out of 5 dentists recommend? There's some logic there. But it does kind of bring to the point, dentistry is reconstruction. Prevention puts dentists out of business. If you reduce the access to care issue, if you don't need the care as much. Preventive care is easy, okay, or easier, I shouldn't say it's easy, it's still expensive. And this one is a slide I like to throw in whenever anybody's trying to take the fluoride out of the water. We have a lot of anti-fluoride people, and they think dentistry is trying to push one over on them when we say fluoride in the water. It's not, it's just the best tool we have. And it says you've been flossing too much and you're not getting enough refined sugar. That's the 5th out of the 4 dentists. So the 4 dentists are usually recommending the right toothbrush. It's usually for their own good. They're just cute. I just like a new baby. It's a good place to end the presentation. Because that's where we start with good habits. Okay, how'd I do on time?
or 50 minutes and 50 seconds on my mark and mark. Not that I'm counting.
I knew you were counting.
So let's talk,
Questions?
let's talk a little more about how we would, you've made some suggestions about how you might bring this down to the Boothbay region, and you mentioned that it's easier to get funding for kids programs and getting into the school. The high school would be good, but then you also mentioned that, so you're thinking of, you need space in the high school.
Space in the high school is would be in the wellness center.
Yeah.
The way most hygiene programs are working with the schools is they are taking portable equipment and going into the schools. In some places they're setting up in kitchens and different things. Setting up the portable equipment, seeing patients. And what we really want to do is, it's important to us to create a program that benefits the children long term. A lot of hygiene programs come in, they see a kid, they clean their teeth because that's what they can get reimbursed for, and then they leave. And they're not connected to the community, which is one of the things we don't want to see happen. What we want is a hygienist that is actually grant funded, so it's not dependent on whether or not she can bill for a prophy or a sealant or a fluoride treatment that is what she does for that child. But if she's salary and grant funded, then it's what is in the best interest of this child. And what we want to do for kids is we want to connect them with a dental home, someplace they go and have a consistent resource and stay with forever. And it's great if kids get their teeth cleaned, but it's better if kids get their screening done, get sealants on their teeth, and have a connection to a viable resource that they can always access when they need care, and that parents know how to access it. Because it's not as much a lack of resources. From down here, it's distance to resources is a factor. But sometimes it's just not knowing how to navigate it. The Jesse Albert Clinic that does see kids has empty chair space. Well, and any time that I've had a kid that's they call me from the school saying, I have a kid and he's got an infected tooth or he's in pain and this is what it is. And they call me, I can usually find some place for a kid to go. So it's not that they don't have any resources, it's that those resources aren't coordinated. And it's better for, rather than everybody saying, I can't get into a dentist in Boothbay when I have kids, to say, okay, well, if you have main care, these are the 4 offices that you can get into that do have subsidies, that can support it. If you have private insurance, then these are the 2 dental offices right on the peninsula. We should be working with them to connect families and people with them. Because they do have room for kids. And a lot of people think, I have a kid, I have to go to a pediatric dentist. Not always true. Some kids can see regular kids. So being part of the planning process, when we're writing the grants and we're setting up our budgets and we're setting up our work plans and we're saying, this is what we need for resources and this is what we plan to do with it. If you're not in the planning process of those grants, as a peninsula, as a program, as the dental community in Boothbay, as the hospital down here, then you're not a line item on a budget and you're not a detailed list in a work plan, then you're not there. So I need people who have ideas to send them to me. Because the only way you get on those work plans is for me to come out and say, hey, we're planning this, who wants to help? Does that help?
Yeah.
Okay. Questions? Other ones? Keep going.
Well, I'm just trying to get the vision of what needs to be in the work plan. So, I think we are interested in having this resource here. It's a matter of understanding exactly what we need to do to get on your work plan.
Okay. That is a list and a whole conversation.
Right. But I like the way you're thinking about it, piggybacking on being able to get money for the kids' care, but then being able to go into some of the nursing homes and so on.
So what would that look like to get started? What would the foundation have to be thinking about? What would that look like?
Well, there's quite a few different grants that we're looking at and working on. So it depends on what your target becomes. And I confuse, when I pick on Les that I have a 15-page paper for him to read, that is just on the outline of the program. That doesn't include the school-based centers, that is our initiatives. So it starts by reading that, because when we look at outreach prevention programs, when we talk about accessing pregnant mothers. Then we're looking at sending a hygienist to be at the WIC locations where Women, Infants, and Children provides checks for young mothers. Sending a hygienist to also provide oral health education, literacy information. This is how you look at your baby's teeth and why it's important. So it's funding for those kinds of things. It's coordination of where are those resources. If I don't know that there's a WIC office in Boothbay, it's not going to be on my list. I'm not going to have mileage budgeted for it. So the main thing is to look at the resources that are on the Boothbay Peninsula and get me a list. Let me know where they are and where those needs are. So back to resource gaps. As far as the schools, I've sent a whole bunch of emails to a whole bunch of school nurses. I don't know that anybody actually gets them, or if they go, oh my God, she's trying to do something with oral health, and they run screaming. Because it is a big project. It is. It's a big project. It's a cumbersome project. It's a lot of work. It has a whole bunch of nuances. Dentistry is expensive and it's dynamic. It's hard to understand even if you're in the middle of it. So a lot of people tend to run away and shy away from it. Did that answer your question? I don't feel like I answered it completely.
It seems so large.
It is large. It is large. Ask any of the doctors that I
So I'm trying to get my mind around some a way for us to start. How
A
do we-
little thing. Find me the people in the schools that would be interested in oral health.
Mhm.
Find me the people that are in the nursing homes or retirement communities that are interested in even engaging in those conversations. Because if I don't have a nursing home or a retirement community that is interested in taking the beauty salon and making some space for a dental chair and setting aside a day a month that it can be used, what's the point of me writing it into a grant and developing a work plan around it? So if I don't have the interest from the nursing homes to develop a project like that, there's no point in me writing in a grant to do it.
That's what I mean. Make
Does
it
that-
smaller, make it smaller, make
Yep.
it
Does
smaller.
that
so-
help?
Yes, yes.
Find me where somebody says, I think a dental program would be great here. And then we could sit down and have those conversations for what would it look like here? What would the availability of services be? What would the scope of practice for the person here be? What would the coordination of resources be? What would the equipment, what would the budget, what would it be? Okay? So, you
And how do we
pictures,
figure out exactly what the needs are for people on the peninsula?
the needs are,
So in other words, how much,
you go on the census website and you look at the number of residents you have living at or below 200% of the poverty level.
okay,
Because they're everywhere. They're everywhere on every peninsula. You look at your population base, number of dentists, you have 2.
yeah.
Number of people on the peninsula. You've got 2 good dentists. I mean, Toby Clarkson is new. Dr. Andrews I don't really know very well, but he has a good reputation. He's a
Yeah.
solid dentist. And again, they're,
3 dentists.
who's the third one?
The one on Townsend Avenue.
Gary Barker?
Barker. And the other one.
He's in Thompson now, isn't he?
There was a husband and wife there for quite a while, and Gary Barker, he has moved and gotten married and gone away, and Toby Clarkson bought his office.
Oh, okay.
Yeah.
But those are always the things that I'm looking for, is there a dentist somewhere that I'm missing? I try to pay attention, I try to keep track. It doesn't mean I always get them all.
Townsend Avenue.
Mm-hmm.
Dr. Green used to be the doctor there, and now there's another one
Is that the same office?
there. Yes. He's got a partner as well.
I think that's the practice that Toby Clarkson bought.
No, he's next door.
That's an eye doctor, optometrist now, Dr. Neto.
The dough is there.
It's not a
Okay.
dentist,
It's optometry.
optometrist.
Okay, all right. That's what I need to do, and I'll go back and look him up. Okay, because he's not on my list. Okay.
I forget his name. He's got a familiar name.
I'll hunt for it.
He got divorced years ago.
That narrows it right down.
Right, what
I
about,
think that's Gary Barker.
is Ann Barker still working in the schools? So, do you know her? Ann Barker?
She's a nurse
Working in the
practitioner.
Boothbay schools?
I think she's the one in the health center.
Yes.
I'm not always good with names. I have
Yeah.
Yeah, she's
Yes.
a nurse
Her
practitioner.
husband is also a doctor.
Who's a-
and that's who
Alan.
the conversation is around with the school-based health center at the high school
Yeah,
about putting a hygienist there.
yeah,
So that connection I've already got.
okay,
That one I'm working on. That one's
Okay.
on my list.
good,
Mhm.
okay,
Uh,
all right.
But as far as Boothbay goes, it's the only one that's on my list. Health and Wellness Foundation is the next one. I kind of went, what have we done there?
Right.
So I'm still building the list of, it's hard to keep dentistry small.
How do we stay connected with you? Do we need a board member to be coming to meetings? Do we need to to get information? How do we?
There's a couple of different ways. There's some business cards and some newsletters out there that have the website and information.
Mhm.
One of the things that we're doing is we have a coalition meeting every third Thursday. We're looking at switching that to Friday mornings, simply because Friday mornings I could probably get more dental people to show up. Thursdays work great for public health people, Fridays work great for dental people. So I haven't quite figured out how to marry those two relationships, but a lot of dentists don't work Fridays, or they do their administrative paperwork and things on Fridays. They see patients Monday through Thursday, and then they take care of business and life and all of the other things on Fridays. So dental meetings are traditionally Fridays, so we're working on coordinating those. There's always on our website, there's always a posting of when the next dental coalition meeting is, which is where we work on a lot of these
And I
things.
get emails, I just don't get to the meetings.
Yep.
So-
And if you look on the website, one of the best ways to stay in touch with what I'm looking at and what I'm doing, because I don't always have time to write everybody these long emails, the bottom of our website, there's the Lincoln County Dental Coalition. It's just a little link at the bottom. Anybody who's talked with me knows to go look for it. You click on that and it takes you to a whole page of all of the things we're looking at. The different programs across the United States that we're talking about modeling, like the Seal America program, what school-based screenings look like, a whole host of things. It's more dentistry than anybody wants to absorb, and even the hygienist looked at me and went, whoa, I don't do all of that. Yeah, so the Lincoln County Dental website is a great place to connect with that. And the email address that's on the cards goes to 3 of us. So one of the 3 of us will always catch something. So, yeah, good question. I'm glad you're interested.
Mm.
I need her name. Can you forward it to me?
Well, we have 16 foundation members, and
Yeah.
not a lot, I'm sure somebody would be. We have some that are really active and some that aren't very active, and this is a great thing.
Mm-hmm.
Somebody should be interested.
One of the things that we're looking at with the board of Lincoln County Dental is really separating out a finance committee that is just a group of people that get together, aside from what do we have in the community, what do we have for needs, who's got what on their list, how do we pay for it? How do we make sure that we create programs that the bills are paid? So the finance program, so anybody who's, there's a great spot. It's where the person who writes a lot of our grants lives, is in that corner of the world for, yes, this is lovely and wonderful, but these are the actual numbers behind it. How do we pay for it? What are the opportunities for billing? What do we know from experience? What are we seeing that people who live at or below 200% of the poverty level can afford? I mean, when you take somebody who is below the 138% of the poverty level, they're living on about $7,200 a year. That's not a lot of money. That's $7,200 a year. It's tiny. And then when they come in to a dental office and they say, hi, we'd like, $3,000 to fix all of your teeth. They go, thanks, I'm starved. So it's hard. It's hard.
How do you measure, if you were to have metrics around, and I'm sure you do, around success. So let's say we needed to get a baseline on the Boothbay Peninsula of where we are now with oral health, with seniors and kids and everybody in between. And then we engage with you in a program, and every year we figure out how much good we've done. What would we be looking at? What are the metrics we need to look at?
It's a wonderful question. It's a complicated answer because it changes for age groups. Our easiest benchmark, or our most basic benchmark that we look at the most, is in 2009, that number one reason for people had been visiting the emergency room for dental pain, 2,400 visits. So 2,400 emergency room visits for dental pain. That's one of our benchmarks. We want to watch that number go down or drastically decline, if not go away. Okay, so that's one of our benchmarks. That's for older children, for older adults. For small children, the Maine Oral Health Funders grant, that's part of the planning process, and they talk about something called a logic model, which if you've ever worked with logic models, I would like to beat my head against the wall with a logic model because it does not follow any logic to me. It's not a flow chart is what they keep telling you, but it is building, it's part of that work plan, and this year is to build in that matrix of how do we track that? Because what that grant is looking for is a 5% reduction in childhood caries in third graders. So in 5 years, and this is it's an ambitious grant. So when you look at the community, from the first year of implementation and doing screenings in third graders to the 5th year, is there at least a 5% reduction in dental decay in those kids? And so that's part of those screening measures and how to keep track of those is, are we actually reducing emergency room use, and are we reducing the number of third grade children who have dental decay? So those are the two benchmarks. The ones in the middle don't have a matrix around them yet.
Yeah, and then you also mentioned the connection between pneumonia and
aspiration pneumonia. That's something that the nursing homes track. That's one of their, and I don't really necessarily understand the medical model of how they track those codes. They think our dentistry is confusing. We think their medical codes are confusing. It is. It's sort of a trade-off. So we all have our own little worlds. But yes, the oral health aids, it's huge. It's huge. 18% reduction in aspiration pneumonia.
I understand that some of this equipment is mobile.
The proposal is to buy mobile equipment. There are generally two different ways that mobile dental programs go on the road. One of them is equipment that you pack up in suitcases and they put on their shoulders like a suitcase and they drag into wherever it is they're going. Okay, it's time consuming to set up. You have a little bit more staff costs in moving that equipment around. The other way that they deliver care is there's a couple of them in Maine, but they set up an RV and they travel and deliver care. And wouldn't it be lovely if Lincoln County owned its own mobile dental unit that could go to all of the schools and see the nursing homes and everything else? Absolutely. Let's have $250,000, please, and about $60,000 a year in expenses and fuel and maintenance and all of that. The car that travels with the portable equipment is far more cost effective. And you don't have some program out there saying, I've given you a grant to buy the van. I've given you a grant to set up the program. Now send it out in the community and pay for it. It's a lot easier for a program to pay for a dental chair and some mobile equipment than it is a big RV. And one of the things that you want as a community, you want a program that respects that connection to the existing dental homes. You want to be able to connect with Dr. Andrews and Dr. Cookson for the small children that are in the schools if they have a need, so that if there's a problem, they can call them and they're in the area. You want to foster those relationships. You don't want an RV unit that flies in and says, hi, give us your money, your insurance dollars, and we're going to leave. Because then the dentists are standing there going, I don't know you. Why are you, no. You come to see me once every 2 years when you have a problem and you want to complain, but yet you don't come see me for preventive care so I can help you. That's the difference between a community, because you want a community-based program that supports the needs of the community, not competes with different components of it. Does that make sense?
Yeah, building relationships.
So with the carried on your back portable model, you have a space, and in that space you have a chair?
Yes. All of the dental equipment that is portable for a mobile dental hygienist to go and see kids and do things in the community is 2 trips to a car, half an hour to set up, and it all leaves with her.
Now, so that room can be used for other things. You mentioned the beauty,
Mhm.
in the nursing home, beauty parlor in the nursing
Beauty
home.
parlor, yes.
So that space can be used for other things. So you move the dental chair out of the way.
Pack it up and take it with you. Yeah, it's like a fancy lawn chair. Yep, it's a fancy lawn chair that,
So what do you do for x-ray? You don't do x-ray, I
you
assume.
don't do the x-rays. Well, we have a portable x-ray unit. There's some logistics around how do you work with x-rays in different spaces. That's something that's sort of at the dentist's reviewing the rules of the state. I mean, if you had a room at St. Andrews, x-ray units are not that expensive. You can buy an x-ray unit and hang it on the wall that the hospital owns for $5,000. That's not that expensive. We have a portable x-ray unit. It's the sensors and the different things that make it digital, that connect to the computer system, that do all of those things that are more expensive. That's the expensive component. Of the initial grant that we got, we put in 2 different size digital sensors because we wanted the program to be able to follow the patients. So if they moved or they needed other resources, we could email it to where they needed them to be. So those sensors were $15,000. I mean, it was a chunk of change. And we really sat setting up a program going, do we do this? Do we not? But here we are, 3, almost 4 years later, we're glad we did. Because it saves a lot of aggravation, saves a lot of chemicals, saves a lot of headaches, it reduces space, creates a more fluid program for the patients to be able to go to a different office. You know, because not everybody is always below 200% of the poverty level. Sometimes people fall off, they end up in dire straits, and then they go, okay, well, now I'm not on unemployment anymore, life is picking up. So go ahead.
Could you talk about dentures a little bit, especially repair?
Repairs are easy for most things. We can fix most any repair, do most any repair the same day. New dentures are a little bit tougher because we operate off grant funding. And so what we do is we've got 4 different lists that people fall into for dentures, because most of them end up in my world. And I volunteer for the programs, and I do 1 case a week that I volunteer for free. Because that's all I can do. We talk about the manicure fees, that's all I can do without raising the fees to my regular patients. One of the things we do with dentures is there's a waiting list, and we're looking for, and that's a whole separate project, we're looking for different funding streams to help seniors pay for dentures. It's one of my pet peeves that we can get lots of funding for kids, but you know, if you're over 65 and you don't have teeth, it's unfortunate. I'm working on it. I'm trying to find more funding for dentures to be able to pay for care for seniors, because it's a big need. The problem with funding for dentures is you can help a lot of kids with $20,000, but when it comes to dentures, they're expensive. They're high-ticket items, they're high-expense items, and even when I work for free, it's still a lot of money for the grants to pay for. So we have a backlog on that list, on the waiting list for dentures. But we make them, we do them. I do the best I can.
But if you need a repair, would you be able to get it done at
Yes.
a reasonable price?
Yes, yes, the repairs, and I don't remember what the fee is for repairs, but I know that through Lincoln County Dental, the self-pay fee for repairs, I know it's under $100, I think it's under $60. In most, there's no waiting list for repairs. If somebody's is a Lincoln County Dental patient that has a broken denture, we just get it in and get it fixed. So, you just have to survive the paperwork process with the ladies, which is some work. Yep.
So if you could wave your magic wand and do anything you wanted to on this peninsula, what would it be?
On this peninsula or in Lincoln County?
No, I'm just on
On this
the
peninsula? Brenda Hamilton and I, who talk about this, she's the executive director for Healthy Lincoln County.
Right.
One of the things that you have the opportunity, that I see you have the opportunity to do on this peninsula, is you have space. One of the things that I notice in public health is that all of the different public health programs are all in different places. Why are all of the public health programs not in one spot? Usually there's politics involved in different things and different businesses and stuff like that are competing entities, and everybody wants to be their own little island. Well, the hospital's gone off the, or is leaving, or I don't really know what the structure is, but they've basically vacated and they've left you a whole pile of empty space. You have a multitude of different public health programs out there that are for the benefit of people that are working off grant dollars, federal subsidies, different programs. Drives me crazy when I look at public health and see where they all overlap and repeat each other, and this one's working on 20% of this one's project and different things. What a waste of money. That community resources, you guys have a Michaela, the community navigator, who's wonderful at bringing people together.
Yes.
And Michaela says, okay, I'm the community navigator, I'm going to reach out to what everybody is doing in the community and help connect people with services. Well, why are all of those people with services all in different places? Gather them together so that if somebody, because the people who are at 200% of the poverty level and below, or the 138 if you're in that, why isn't the senior center in the old hospital space combined with the one room you set aside for dental, combined with Michaela's office to say, what do you need, to look at the physical therapy department? It's a whole floor. I mean, yes, I think physical therapy is wonderful, but a whole floor? Let's carve out a 10 by 10 room for, for tennis. So I would look at that space wisely and say, because up in Damascotta, Brenda and I talk about one roof, because we're hurting on space up there. We really are. Everybody's crunching on space and sharing space and overlapping. And so we talk about building buildings that are one roof. All of those public health programs in one space, in one area, to be able to access them conveniently and not need as much public transportation to get from point A to point B to point C. Just let them pull in and make their rounds.
It's a great vision.
You have space to get everybody under one roof.
Okay.
Not to show up and be opinionated.
No, that's good. That's great.
You were supposed to stop me if I started saying
Oh, I'll stop you. I like to hang out with effective people, and I like to hang out with fun people. And you're listening to one of the most fun and effective people that I know. Period. Full stop. She won't accept that, I know, but it's absolutely the case, and it's why I hang out with her, and I highly recommend you guys do the same thing. Okay, will that stop everything?